Hello and welcome. My name is Taj, Medicare Sales Agent, Consultant, and Advisor, back with another video bridging the gap between the senior demographic and Medicare sales agents. In today's video, I'll be comparing Medicare Advantage plans, also known as Part C, against Medicare Supplement plans, also known as Medigap. We'll explore costs, reasons to adopt either plan, and which one makes the most sense for someone enrolled in Part A and Part B. If you're unfamiliar with Medicare, I recommend checking out my channel of other videos discussing Medicare options in the top right corner of this video to get some foundational knowledge. Then join me back over here. All right, let's get it. So this is our scenario. Which healthcare option is best for Tessa? Tessa is the example person that we'll be looking into here. Tessa lives in Chatham County, Georgia, zip code 31405. Her birthday is May 15th, 1959. Today's date is March 23rd, 2024, and she is now enrolled in Medicare Part A and B. Tessa had a career as a software developer, earning an income of $120,000 per year, and retired due to growing health concerns and doesn't get around like she was able to in earlier years. Tessa has diabetes and congestive heart failure runs in her family, so she is taking 6 medications: metformin, lisinopril, atorvastatin, gabapentin, amlodipine, and diclofenac, paying $100 per month out of pocket for her prescriptions. While employed, she was able to save $300,000 by the time she retired and now receives $2,000 in Social Security income as her only form of monthly income. She's single and still pays a mortgage of $900 per month, and her car payment and insurance combined cost her $375 per month. Tessa doesn't travel outside of her area unless it's medically related and prefers to keep her same doctors. She's heard from some work associates to look into a Medicare Supplement Plan G, and her relatives suggest looking at Humana Medicare Advantage options. She no longer receives health benefits from her company and is now wondering which health plan may be the right fit for her. All right. So, what we know: monthly basic expenses in the aggregate, $1,375 per month. She needs healthcare coverage. Plan G and Humana Medicare Advantage were both recommended to her, and she prefers to keep her same doctors, which she currently is seeing a primary doctor and an endocrinologist. She takes 6 medications per month, listed here. She doesn't travel too much except when medically necessary. And our objective today is to find adequate healthcare coverage for Tessa that accommodates all of her present needs and safeguards against future concerns, along with ensuring the coverage fits within her available budget. All right, so let's go ahead and take a look at that. We know her income is $2,000 a month or $24,000 a year, and her living expenses breakdown right here: mortgage, car, medications. That all equates to $1,375 per month, and for the year, $16,500. All right, so if we subtract the living expenses from the monthly income, we get $625 per month or $7,500 a year is what's left over. Okay, so we're on Medicare.gov, which we're going to use for this example. First, we're going to explore Supplemental Plan G. As you know, Tessa is 64. She's aging into Medicare, turning 65 soon. She's a female, and we didn't talk about it, but she does not use tobacco. Now let's scroll down here and let's take a look at Plan G. Okay. As we can see here, the monthly cost on the low end can be $356 per month. On the high end, $2,239 per month. These are estimates, and the actual price will be determined by whichever company she decides to go with after they go through the application process. This plan does not cover the Part B premium of $174.70 per month, so she will have to pay for that monthly. Now, there are no copays and co-insurance associated with any Part B services. With a Plan G, it's $0. There's also a $0 deductible under this plan for Part A, but there will be a $240 deductible for Part B, which she will have to pay first before this plan will start helping her with her medical and hospital needs. And if you look all the way over here to the right, the plan benefits, you'll have some skilled nursing facility coverage, coverage of the Part A deductible, no coverage for Part B, and we're not going to talk about this excess charges or the foreign travel emergency charges. Most people don't even need either of these. Now, if we click plan details, we'll get a more in-depth view here. All right, so we see for the hospital stays for days 1 through 60, there's a $0 charge. Days 61 through 90, a $0 charge. Days 91 through 150, also a $0 charge. And even if she needs an additional 365 days, there will also be no charge here. Now, after that 365th day, she'll have to pay for all the hospital and or medical costs out of her own pocket. Something to consider. And as far as skilled nursing facility for days 1 through 20, no charge. Days 21 through 100, no charge. And after day 100, she'll incur all the costs. So another thing to consider. Alrighty. Now let's go ahead and take a look at the drug options. Okay. Still on Medicare.gov, and what I've done was input all of her medications beforehand. And when that is done on Medicare.gov, what happens is they show you the topmost plan that would be the best in accordance to the medication she's taking. So if you look over here, it says sort plans by lowest drug plus premium cost, and that's exactly what we got. So this is a WellCare Value Script standalone prescription drug plan. Looks like the monthly premium here is 50 cents, and these total drug and premium cost is for the rest of 2024. And right now we're in the month of May, which means we have 7 months left in the year. So these amounts here are based on having 7 months left in the year. So don't pay attention to these. We'll have accurate costs when we hop back over to the scenario. Okay. And the deductible amount is $545. If you saw any of my other videos about Medicare supplement plans, then you know that this is the amount that has to be paid before the plan can be utilized for any drug needs. Now let's hop into the plan details here. Okay. Scrolling down. As you can see, this is a list of her medications and $0 cost for amlodipine and also a $0 cost for atorvastatin. When it comes to the diclofenac and the gabapentin, we see that there is a $35 charge and another $35 charge. So again, these amounts are based on the remainder of months left in the year. So what you do is you take the remainder of months, 7, we would divide this number here by 7. So this medication is $5 per month for the remainder of the year. And the same thing down here with gabapentin, lisinopril, $0, and metformin also $0. And her total yearly drug cost for the remainder of this year, $70. Now, when we hop back over and we take a look at the prescription drug plan, we see that her plan premium is 50 cents per month, so that would cost her $6 per year. The plan deductible is $545 per year and would break down to $45.42 per month. But since we know this is a deductible and the whole amount has to be paid before the plan can be utilized, we'll pay more attention to this amount here. This is just for the sake of calculation. Medications will cost her $10 per month. So there's a charge for the diclofenac and the gabapentin, and combined, that's what gives us this amount here. And for the year would cost her $120 per year. So she's looking at a total amount of $671 per year, broken down $55.92 per month. All right. When we look at the combined cost of Plan G and the prescription drug plan, that is going to cost her $7,734.40 per year, or $644.53 per month. But only looking at this yearly cost, $7,734.40, we scroll back up to the amount that is left over after she's done paying these expenses up here. And she has $7,500 left over for the year. So that's her income. And considering the plan G and the drug plan, that puts her over that limit. Now, she does have a savings of $300,000. So that is something that she would have to consider. Would she want to dip into her savings? And that would help her make her determination. Now, let's go ahead and look at Medicare Advantage. So again, still on Medicare.gov. And since there is a drug component with Medicare, this Medicare Advantage plan, what I've done is put in the medications. And again, what it does is shows us the best plan based on the medication she is taking. So we have here the Humana Choice PPO plan, and she does want to look at Humana. So we see that her monthly premium for this plan is $0. This plan does not cover the $174.70 Part B premium, so that is something she will have to pay. And the drug premium and costs, again, is for the rest of 2024. But either way, $0 charge here for her medications and no drug deductibles, which we see down here, and no health deductible, which we see right here. And these amounts, the $550 amount and the $8,950 amount, is what's known as the maximum out of pocket. So let's say, for example, worst case scenario, she got into an accident and she has high costly medical bills. They're like $50,000. Being that this is the maximum, this is the most she'll have to pay towards that $50,000. Any amount above this amount or this amount here, if she's getting services out of the network as well, will be covered by the plan for the remainder of the calendar year. So this is like a hypothetical, but either way, that's still the max she'll pay if she's only getting services in network. And this is the max she may be required to pay if she's getting services inside the network and outside the network. If we look over here to the right, we see that she'll get some vision. She'll also get some dental. She'll also get some hearing. No transportation, but Tessa does have a car, so no concern there. She'll also get some fitness benefits and worldwide emergency coverage along with telehealth services. Now, the copay to see her primary care doctor is $0, so no charge there. And she will have a charge to see her specialist of $15 per visit. And right now, she is seeing an endocrinologist quarterly, so 4 times a year. So she's looking at a charge of $60 for the year. Oh, actually, now let's hop into the plan details so we can take a deeper look. Okay. So since we looked at the hospital costs for this supplement, we'll look at them here as well. The inpatient hospital coverage copay for in-network services is a $298 per day copay for days 1 through 7, and a $0 copay per day for days 8 through 90, and also a $0 copay per day for days 90 and beyond. So as you can see, with Medicare Advantage, there are copays associated with aspects of the plan. If you scroll up here, we have diagnostic tests and procedures, lab services, diagnostic radiology services, and so on. And we'll see the associated copay amounts here. So this is something that she would have to consider when thinking about Medicare Advantage. All right. And lastly, for this example, we'll look at the skilled nursing facility. The in-network copay for skilled nursing facility is a $0 copay per day for days 1 through 20, and a $203 copay per day for days 21 through 100. So, we don't get any younger, we always get older, so there's always a potential need for things like skilled nursing facility. So again, another thing that Tessa would have to consider. Okay, let's jump back over here. All right. So the plan premium is $0 per month and $0 per year. The plan deductible, the same, 0 and 0. Primary care doctor copay, 0 and 0. And the specialist doctor copay amounts to $60 per year or $5 per month. There's a $15 charge per visit. And right now, again, Tessa is seeing her endocrinologist quarterly. And medications, no charge whatsoever. $0 per month, $0 per year. And so our total is approximately $5 per month, $60 per year. So Which option is best for Tessa? Let's talk about it. Tessa's upfront costs will be higher with the supplemental Plan G and drug plan when compared to the Medicare Advantage plan. She'll also have a higher monthly cost for the Plan G and drug plan than she will with the Humana plan. Noted earlier, we saw that if she were to go in the direction of getting the Plan G and the drug plan, her monthly total expenses would exceed the income she's bringing in each month. Since she has a savings of $300,000, in theory, she could use portions of that to help cover upfront and ongoing expenses, but she would need to keep in mind that her Plan G will rise in cost every year as she ages, and her drug plan and premium, deductibles, and costs are also bound to rise every year. Another thing she would need to keep in mind are new medications she might take in the future, grocery expenses, gas, treating herself, or any other miscellaneous costs she might incur. Still, the cost of the Plan G, drug plan, and any other expenses may not be too big of a concern for her since she has a savings of $300,000. There is a positive when considering her current health condition. If her health were to get worse in the future, she would have peace of mind knowing that her doctor visits and medical and hospital procedures would cost her nothing. When considering the Medicare Advantage plan, we know that Tessa would not have any upfront costs, and her expenses to obtain the plan for a year would not cost her anything. Her drugs would be included in the plan, so she wouldn't have to pay separately, and her medications wouldn't cost her anything with the Medicare Advantage plan. She'd have additional benefits included in the plan as well. Tessa's initial year cost for the Medicare Advantage plan would be significantly lower than the amount left over after covering her mortgage, car, and drug costs, meaning that she'd have more money available on a monthly basis without having to touch her savings. The potential downside of the Medicare Advantage plan is that she will have copays when she needs hospital or medical concerns or has to see specialists. So, Tessa needs to consider whether she would want to dip into her savings to pay nothing when she needs hospital and medical services and seeing specialty doctors. She'll also need to think about all of her other monthly expenses and ask herself how comfortable she is with her available funds after everything has been paid for every month. Will it be enough to live on or no? Will she need any additional coverage like dental, hearing, and vision? Going in the direction of the supplement plan, she would need to think about how long her $300,000 savings will last. Will she outlive what she saved by going in the Medicare supplement route? If she's thinking about the Medicare Advantage option, then she would need to consider how much value having low monthly and upfront costs will be compared to having to pay copays whenever she needs certain hospital and medical services. So, the decision can go either way and is entirely dependent on what Tessa will be most comfortable with. Some people don't like the idea of having copays. Others know that they'd rather keep more money in their possession on a monthly or yearly basis. As always, I recommend getting with a Medicare sales agent, advisor, or consultant to help weigh the options. All right, that's it for now, folks. If you found today's video helpful, help me help you and others by subscribing, liking, and sharing this video. If you have any questions, comments, or concerns, please feel free to leave a comment below and I'll get back to you as soon as I can. Thanks for watching. See you in the next one.